Hello everyone. Thank you for the invitation to speak in this session. It's a pleasure to share some of our reflections from our last Rare Disease Plan on behalf of the Northern Ireland Rare Disease Framework Implementation Group. Definitions of a rare disease vary throughout the world. In 2013, the UK Rare Disease Strategy and our Northern Ireland Implementation Plan defined a rare disease as a life-threatening or chronically debilitating disease that affects 5 people or fewer in 10,000 and requires special combined efforts to enable people to be treated effectively. More recently, that definition has changed from quantitative and qualitative to being prevalence-based, so that the 2021 framework definition for a rare disease is a condition which affects less than 1 in 2,000 people. Northern Ireland will also adopt this definition as we're looking towards developing our Rare Disease Action Plan with a view to launching that in 2022. With approximately 1 in 17 people affected by a rare disease at some point in their lives, there are more than 110,000 people affected across Northern Ireland. That's more than 400,000 people impacted across Ireland. Our Northern Ireland Rare Disease Implementation Plan included 51 commitments for delivery under 6 key themes. Theme 1 was empowering those affected by a rare disease. Theme 2, identifying and preventing rare diseases. Theme 3, diagnosis and early intervention. Theme 4, coordination of care. Theme 5, the role of research. And Theme 6, improving cross-border North-South Ireland collaborations. Developing our molecular services comes under all 6 themes of this plan, although the primary association is clearly with Theme 3 for diagnosis, facilitating early intervention. Following extensive patient engagement events, patients and families across Northern Ireland requested whole genome sequencing to improve diagnosis, so our Northern Ireland Implementation Plan included Northern Ireland participating in the English 100,000 Genomes project. This was facilitated by the creation of a virtual Northern Ireland Genomic Medicine Centre. Our Northern Ireland Genomic Medicine Centre was funded by the Medical Research Council and our Northern Ireland Executive to facilitate people from Northern Ireland participating in a 100,000 Genomes project and getting whole genome sequencing with an improved diagnostic yield. You've heard a little about this already from my colleague Katie Kerr. We had more than 1,000 participants where basic analysis resulted in a diagnostic yield of approximately 22%, bearing in mind that many of these probands had previously not obtained their genetic diagnosis through traditional genetic testing. The participants selected for whole genome sequencing were carefully selected to be likely to have a genetic diagnosis. So we asked ourselves, why was the diagnostic yield not better? There are many options to improve the diagnostic yield, including more in-depth analysis of the genetic data beyond simple preset panels and top-ranked variants. We can look at systematic analysis of multi-omics, such as epigenetics, transcriptomics, and proteomics that are being used to accelerate rare disease diagnosis. One relatively inexpensive, if often laborious, approach to improving the diagnostic yield is to improve phenotyping information that's available to bioinformaticists. For many participants undergoing whole genome sequencing, only the minimal data set was used when submitting samples, so this very much limits A, the initial selection of in silico target panels for bioinformatic analysis, and B, the evidence searching for putative disease-causing genes. People were recruited by multiple specialties, so for example, a cardiologist may not have included information about a renal phenotype of their cardiac patient undergoing whole genome sequencing. And this very much limits the diagnostic panels that are used for the analysis. Our participation in the 100,000 Genomes project also made us realise that current systems were missing a critical element in the process of obtaining an accurate diagnosis for our patients. To improve phenotyping in the short term, the Department of Health Northern Ireland funded the development and implementation of GenoCianic as a genomics open core engine for accelerating Northern Ireland care, to essentially provide an open platform for the purpose of providing genomic medicine as mainstream clinical care for the citizens of Northern Ireland. The key elements it provides include a mechanism for clinicians to securely submit patient phenotypic data to inform genetic testing, and really to store this in an OpenEHR compliant clinical data repository. Clinical decision support to help streamline the process involved in genetic testing, such as guiding selection of genetic tests and selection of targets for follow-up, and also support for our molecular multidisciplinary team meetings to help translate sequencing variants into validated results. It's also particularly useful to minimise the administrative burden by handling consent reports and feedback to patients in a streamlined manner. The development of Encompass and Northern Ireland's digital integrated care record has significant potential to improve our rare disease patient care, with customised training for data coding and input of phenotypic information critical to maximise diagnoses. Together with our primary care datasets, GeneOceanic and Encompass offer significant potential to help drive forward research with de-identified longitudinal data. To obtain views from patients supporting the development of a genomic medicine service from Northern Ireland, 2 surveys were conducted, one near the start of the project in 2018 and one where our processes for whole genome sequencing were more established in 2020. Of particular interest, 67.5% of respondents to these surveys waited more than 5 years to obtain their diagnosis before they participated. One participant reflected that it would be great to have information instead of Google and finding relevant information to me. Respondents unanimously agreed that they would benefit from having all information regarding living with a rare disease in Northern Ireland, including useful contacts, disease information and support groups available in one website or centralised hub. Although clearly it should also be borne in mind that not everyone is particularly confident when using the internet or indeed has decent access to the internet across Northern Ireland. Some patients waited a long time to get their results. Now, this was primarily outside our control. It was an exploratory project, but it did emphasise the need for regular contact with patients undergoing such tests. A web-based support service similar to the NHS's Inform Web chat service would allow patients to make inquiries with some degree of anonymity and may encourage them to ask the questions without them needing to feel particularly rushed. And then this also gives healthcare professionals a chance to provide a well thought out and informative answer. The need for the creation of a peer support database for participants recruited to the 100,000 Genomes Project was suggested, where participants would consent to be added to the database and to be put in touch with individuals managing similar issues. Overall, the patients said that being part of the project gave them hope to see things are progressing and moving forward. They were very keen to avail of the opportunity. Patients were so grateful to be involved, and many were very, very excited to take part in such cutting-edge research. Patients were delighted to take part in this excellent opportunity. Participants received the results from the programme in a variety of ways, and with hindsight, after receiving the results, whether these were positive or negative in terms of obtaining a diagnosis, 1/5 of respondents said they would have chosen to receive the results differently. Thoughts did vary, although many felt that a face-to-face appointment was preferable. Some of this was due to the pandemic, but one individual said, for example, getting results during COVID-19 via letter was particularly disheartening. 86.2% of respondents wanted direct access to their genetic data as part of an online patient portal to help them manage their complex healthcare needs. Some participants were very keen to have a lot of questions answered. If the recruiter didn't know the information, that was okay, as people were very happy to be signposted to another person or a better resource for information who could help. More than half of the respondents wanted much more information provided in accessible formats, in particular information about realistic timescales, follow-up mechanisms, feedback, and better communication throughout the testing process. A website or a place for regular updates to keep participants up to date would be very good, and knowing more about research options would be welcomed by many patients. We also sought the views from healthcare professionals, and this was done by holding 2 workshops and 19 interviews across 8 medical specialties between November 2020 and March 2021. The healthcare professionals were very enthusiastic about participating in the 100,000 genomes, and they said many patients had heard about the project in England and were grateful for the opportunity to participate from Northern Ireland. The majority believed whole genome sequencing is a critical step in helping their patients and would be keen to participate in future initiatives. Some learnings from the project included having more administrative support. Despite our best efforts to streamline the project, there was a heavy workload, so our healthcare professionals needed protected clinical time to ensure that patients understand the processes, the tests and the results, in particular the consent. This is particularly important when explaining concepts to patients for whom English is not their first language. It's also very important to invest time to get wider family members on board for sequencing, to make that aspect of the project work well. So for example, where we're looking parents and siblings. Many healthcare professionals found the consenting process too complicated, and while their newer patients who did not regularly attend the clinic required much more discussion and therefore more clinical time. It's important to note that not all services were able to deliver on this project. All were very, very keen to participate, but with the magnitude of work involved, it was more than all the teams could individually deliver. And that led to a lot of frustration. One feature that was strongly supported was the opportunity to have more collaboration between clinical and research teams. It's particularly important to build up a collaborative research team between Northern Ireland universities and clinical teams, considering how best to improve health service delivery. Several suggestions were made to enhance future programmes. For example, all participants were very keen to maximise their skills with genomic medicine. Many people wanted more information to help them gain confidence in whole genome sequencing, particularly around delivering results to patients. Several people worried they were doing a disservice to patients by not making more frequent referrals to genetics. The recruiters wanted to know the study outcomes. At the moment, we had reported diagnoses for people back to consultants, not necessarily the person doing the recruitment, who had clearly invested a lot of time in the process. More clarity around timelines from recruitment to results would be helpful, and as would a contact point to keep patients updated on progress. Overall, the healthcare professionals reported a positive experience of the 100,000 Genomes Project and are very keen to pursue similar research projects in the future to enable them to provide the best possible care for their patients. Many of the clinical service delivery options driven by our Northern Ireland Rare Disease Implementation Plan have resulted in valuable upskilling of staff, including through the 100,000 Genomes Project for molecular services in particular. However, many healthcare providers delivering the 100,000 Genomes Project struggled to remember details of training and suggested that better timing and better easy access to literature for refresher training was requested. Most of the healthcare professionals interviewed do not routinely pass information to patients. However, many of those that do rely on information printed off a website or blog pages. Healthcare professionals and patients both find it difficult to access appropriate information, particularly for rare genetic conditions. A centralised website where information is available in various media sources, providing visual, text message or links to videos, was requested. The more understandable information we can give to patients, the better. We have an evolving programme of local workforce development, including CPD accredited events, as well as harmonised rare disease molecular teaching across Queen's University Belfast and Ulster University that includes those all-important patient voice sessions. We've also developed a couple of rare disease toolkits for our general practice community. So the legacy from our Northern Ireland Rare Disease Implementation Plan includes the foundation of an All-Ireland Rare Disease Research Network. What we know going forward for our Northern Ireland Action Plan in the future is to have smart deliverables that are appropriately costed. The many developments delivered as part of this implementation plan would not have been possible without a lot of people across Ireland. So I just want to take this opportunity to say thank you very much, everyone. And if you'll bear with me, I'd just like to highlight that we held a knowledge exchange workshop in 2020, talking about prioritising recommendations for rare diseases across Northern Ireland, and that's informing our Rare Disease Action Plan 2021. We'll be talking about that at a public engagement event at lunchtime on the 27th of September, so please do come and make your views known and help shape the next Rare Disease Action Plan. Again, thank you very much, everyone.